Good afternoon, and thank you for joining us. My name is Kathryn Goodman, and I am the Public Information Officer for the Thomas Jefferson Health District within the Virginia Department of Health. I'm joined here in the studio today with Ryan McKay, who is Incident Commander for the Thomas Jefferson Health District, and he's going to get us started with showing how to properly remove a face mask, and then we'll introduce all of our panelists and get started with sharing updates and answering your questions live. Thank you.
Thank you, Kathryn. So normally we would want people to be wearing a face covering, but for purposes of today's town hall, I'm going to take mine off just so it's a little easier to hear me. To do that properly, we want to take our fingers and put them around the strings here like this so that we're not contaminating the inside of the mask. Simply pull off and lay flat on the table in front of me. Again, this prevents any sort of contamination of the inside of the face covering.
Great, thank you. And to get started, I want to quickly have everybody wave on camera. So we have here joining us today Chief Baxter, who is the Chief Baxter, the Charlottesville Fire Chief. Boy, am I jumping over my words today. This is our third town hall. You think I'd have it a little bit better together. So, sorry. So, Chief Baxter with Charlottesville Fire Department. We have Dan Eggleston. He is the Chief for Albemarle County Fire and Rescue. And we have Chief Longo. So Tim Longo is the police chief for the University of Virginia and the vice president of UVA Safety and Security. So thank you. I'm sorry I'm jumbling over my words. It's been a long 2 months, as we all can relate to that. So I'd like to get us started today with looking over the data. I'm excited to share that the Thomas Jefferson Health District has launched a new data portal, and it's on our website at www.tjhd.org. And on here you can see, we're just doing a quick screen share so everybody can see what this is. On the top here, we have the total cases today. So the new cases today are within the last 24-hour period. So this website is updated daily at 10 a.m. And so within the last day, we had 9 new cases. To date, as of today and this morning, we have 337 cases throughout the district, 61 cases hospitalized, and unfortunately 13 fatalities so far. On this bar chart, you can see the dark blue represents the total cases per day, and the yellow represents the daily case numbers. And we know it's a little bit small, but it's the easiest way that we can show it in a full chart for you guys. Moving down, there's Tjhd locality data. So our district covers Albemarle, Charlottesville, Fluvanna, Greene, Louisa, and Nelson. And we have a breakdown of each locality for their total case numbers, hospitalizations to date. So that is not the total number of people who are currently hospitalized, but rather the total number of people who have been hospitalized since we had our first COVID-19 case 2 months ago. And we also have fatalities per locality. Moving down, we have the cases by race, by sex, and by age group. That's district-wide. We then have district-wide hospitalizations by race, sex, and age group, and fatalities by race, sex, and age group. We've broken down each of these so that people can see specifically what the demographics are within our health district based off of race, sex, and age, and we think that's an important indicator for us to understand what's happening, where we need to focus maybe testing efforts and other priorities for our COVID-19 outreach efforts. On the bottom of the page, we also are listing out the Albemarle County Regional Jail data. So at this point, you can see on there that we have 0 people who are incarcerated in Albemarle County Regional Jail that are positive. That goes the same for the Fluvanna Women's Correctional Facility. And for the Albemarle County Regional Jail, we did have 4 employees who were positive, and that was actually in March. So those cases are pretty likely back to work and safe now. So that's the full overview of our data portal. We're excited to share that with you all, and it is updated daily at 10 a.m. So we hope that this creates an easier way for people to get access to our data and lets folks know that we're trying to be as transparent as possible. We've also received a lot of questions about testing data. And so come Monday, the Virginia Department of Health will be launching a new data portal with all of the testing numbers for the entire state. They will actually be broken down by zip code, so you can type in where you live to see how many folks in your area and your zip code have been tested. And we'll be sure to share all of that on our social media pages as well. So to get fully started with all of our programming, now that we've shared the data, I'm going to pass it over to Ryan McKay, who again is the Incident Commander for the Thomas Jefferson Health District, so that he can provide an update on what the district is doing with COVID-19 and how we're helping the community.
Thank you, Kathryn, and thanks to you who are watching and participating. We really appreciate the support. Certainly appreciate all of the physical distancing, the face coverings, and the acts that the community has done to slow the spread of COVID. Obviously, it's working. The governor just announced at 2 p.m. today that we will move into phase one, tentatively move into phase one a week from today. And what this means is some of the restrictions that have been placed on non-essential businesses like restaurants, breweries, gyms, fitness facilities, faith-based activities will ease a bit. There's going to be specific information on the governor's website. And what we want to do today is sort of highlight how we're preparing and how we're going to provide guidance to the community. Part of this is an ability to expand our testing capacity and our ability to contact trace following tests. A little bit about the testing. The more we can test, the more we can identify how widely spread COVID is in our community. It helps us inform decision-making about how to proceed, what guidance to provide. To expand testing, a couple of things are happening. One, we're working to hire and expand the number of testers that we have on hand at the health district. We're building a team who will go out into the community and conduct community site testing. Basically, this will enhance our ability to reach specific communities throughout our health district to open up access to testing. We've already worked on this plan. We've already implemented it to an extent. We held our first community testing event in Fluvanna County back in April. Today, we held one in Louisa County, and then working with various partners, others have happened, for example, in Southwoods and Albemarle County. In the near future, we'll have testing events in Nelson County, Greene County, at Yancey Community Center in southern Albemarle County. And we'll also start hitting locations within Charlottesville and Albemarle and throughout the rural areas of our health district where access has been a problem, where disparities have been historically problematic for groups of people in our health district. This would be a way for us to expand our testing capability and our capacity through the testing teams. Beyond that, we need to be able to determine what to do once a positive test comes back, and that's where case investigation and contact tracing comes in. This is an interview process that's conducted by a case investigator to ask the individual who tested positive a series of questions to determine how long they've had symptoms, to identify locations they went to, people they had interactions with. And the idea is that we identify those individuals and give them guidance on how to best isolate so that they're getting better and protecting others as well. It also helps us to identify individuals who may have been in contact with that person, who may have been at risk. We contact those individuals, we talk about the interactions they had, and we give them guidance on quarantining for 14 days. And the idea is that they are monitoring their symptoms during that 14-day period. They're limiting contact with others, particularly those who are among the most vulnerable, people with health conditions that are chronic, people who are over 65, and individuals who may not have great access to health care. The key to being able to reopen slowly is going to be slowing the spread of disease once we reopen. Testing, contact tracing are going to be extremely important for that. To build our capacity within the health district, we are also hiring a number of contract staff who will focus solely on contact tracing. We're looking for a team of about 15 to 20 people, and we've received numerous applications for that process. And we hope to have that team on board and up and running independent of our staff by the end of June. There's a little bit of a transition there in terms of training, making sure that they're able to understand and apply all of the methods that we're using. With all of these changes, there's going to be guidance that's needed for all of our employers, for the faith-based community, for individuals in the community who may reopen to some extent. In the coming days, we'll work with VDH and we'll identify CDC guidelines that are most applicable to our health district, provide guidance for those seeking it. We'll share that information through local media and certainly on our COVID webpage on the tjhd.org website. The idea is that we're working with our community to reopen in a way that's going to be most safe, that provides for the protection of the health and wellness of our community, and done so in a way that's practical.
Great, thank you. And now we're going to pass it over to Chief Baxter with the Charlottesville Fire Department to provide us with an update on what the city is doing and what his efforts have been lately. Oh, and
works better when you take the mute off. Thank you, Kathryn. So, based on what we just heard at 2 o'clock from the governor's news conference, and we've been planning on hearing that message for quite a bit of time now. I would just echo what Ryan said. The reason we're even talking about moving from mitigation to phase one is because of the collective efforts of the community, staying home and following all those other best practices, physical distancing, hand washing, cough etiquette, masks, etc. So that's a positive. We need to make sure that the community understands and appreciates that the reason we're here talking today about moving from mitigation to phase one is because of their efforts. So thank you to everyone out there for doing that. Our focus right now in the city is really on this transition. So we don't expect many changes to how we're providing what are really essential services now as we move into phase one. We have been going through a very structured planning process for well over the last month to try and visualize and plan for what each of these phases will mean for city government. We've had a team of folks that have been meeting with every department and working through all of those details, trying to capture what efficiencies have been gained. And I think we're all incredibly aware now of the power of telecommuting and video conferencing in a way that we weren't 8 or 10 weeks ago. Also changes that we're going to need to make to physical spaces, to workspaces within city facilities, and beginning to plan for that now and do the engineering and the budgeting for that. And also to our business practices and our programming. So as you can imagine, just as an example, as a hypothetical, phase one limiting to 10 people still, you can't have a summer camp. But when we're at 50, there are probably some programs that we can think about starting to stand up again. And then also all through those planning phases, we're really focused on making sure that whatever we put in place, that it's focused on keeping our employees safe and healthy and the public safe and healthy as well. So making sure that we have signage and masks and hand sanitizer available, and that we're incorporating cleaning practices in a new way in all of our spaces, and doing all that planning. I would also like to mention too that we've talked about this a number of times in various forums. We have seen and continue to see a pretty dramatic drop in the use of 911. Our transports in the last month compared to a year before the same month, April, are down 43%. We do have some concern that people are not calling 911 if they're having a significant medical emergency. So we do want to encourage people, if they're having chest pain or they're short of breath, or if they believe they're having symptoms of a stroke or some other major illness, to continue to call 911, because that's what we're here for. So that's where we're at right now, Kathryn.
Great, thank you for the updates. And it is very important that we do remind folks it is safe to call 911 and go to the emergency departments right now. So speaking of that, 911 calls, let's tune over to Chief Eggleston. If you can tell us what is going on lately with the Albemarle County Fire and Rescue and with Albemarle County as a whole.
Certainly. Like the city, we have been focusing on the governor's announcement with phase one. In fact, we've been anticipating that for quite some time. So we've been working very diligently to ensure that, that government services are continue to be offered, and as well as we do it in a safe manner to ensure that we focus in on our employees and provide a safe working environment. So we have had plans laid out to really ensure that happens. We don't anticipate, like Chief Baxter says, many changes in phase one, because we never really stopped essential services. We never really shut the building down. We just scaled back quite a bit. So in reverse, we'll scale up when appropriate. Right now, within phase one, we don't anticipate many changes. We've been working really closely with our elected officials to ensure that the process of public input and the process of democracy itself continues in a very meaningful and involved manner as we move forward. What we've also been doing, obviously, is supporting the EOC efforts along with the city of Charlottesville, Chief Baxter, and the Department of Health, with Ryan's help as well, to ensure that we're focused on helping our most vulnerable population, mainly our long-term care facilities, working very, very closely with those facilities to ensure that we provide the best support so that they minimize the impact of the spread. So while it may not be quite as intense as it was several weeks ago, we're still keeping an eye on that to ensure that hopefully as the trend continues to go downward, that we do this in a very safe and deliberate manner.
Great, thank you for the updates. And now we'll head over to Chief Longo with the University of Virginia. If you can tell us what's happening with the university, what their plans are, and what the community should know.
Sure, Kathryn. Good afternoon, everyone. Let me agree, Kathryn. I'm sure I speak for my colleagues as well. It really has been a very long 2 months, certainly not just for us, but for this entire nation. The impact of COVID-19 on the university community is really no different that it's been for every other person, family, church, business, or virtually any corporate enterprise that's been impacted by this terrible disease. It's certainly tested the capacity of every inch of our physical infrastructure here at the university, and frankly, every person who helped keeps this place operational each and every day. It's been particularly troubling as we've watched our community impacted, particularly those who are the most vulnerable. But that being said, I've really watched the community show up, take ownership, take personal responsibility, help each other, and do our best to sustain as a community. Certainly our healthcare workers, both here at the University of Virginia and at Martha Jefferson Sentara, and those throughout the community and private doctors' offices have shined beyond anything we've ever seen before. Our first responders, my colleagues and their staff have stretched ourselves to our very limits, yet we've managed to sustain ourselves and be healthy and be able to continue to support our community and serve our community. And so now it's time to work towards recovery, as I suspect the governor's remarks today were a reminder that it's time to recover slowly, but to recover nonetheless. I think that's going to require a good mix of critical thinking as it relates to data, but also experience. And frankly, a spirit, I think, of creativity, of how we use our assets and begin to do the work across the university environment. I know President Ryan, his executive leadership team, and a host of really smart and innovative people across both the academic and medical landscape of the university are working hard to prepare for the fall of 2020. As I sit here today, I can't tell you precisely what that will look like. It's a work in progress. It involves thinking about not only our academic progression, but also how we function as a business, and having the supplies and resources at our disposal to be able to function in a way that's safe and preserves the health and welfare of our students, our faculty, our staff, and the people who come and visit this university community on a regular basis. Undoubtedly, President Ryan's plan will be a roadmap that will guide our work into the fall and throughout the next academic year. There's a couple notable things I want to just mention very briefly. My observations in the midst of this crisis, as I alluded to before, I've seen some really civic-minded people and groups kind of come together to support the most vulnerable in our community, whether it be housing for the homeless, food sustainability, increased testing, as the health department has been so gracious and in concert with our hospital systems, supporting our assisted living and nursing facilities who were impacted by COVID, charitable support for those who have lost their jobs, and even assistance to our regional jail in ways of testing and increased telemedicine. So there's been a lot of work done, but there is a lot of work to be done as we go into this phase of recovery. So, and we're privileged here at the university to be part of that and to be part of this great community.
Thank you. That's we actually had a couple questions already that people had submitted asking about when UVA was going to open up, and it sounds like those plans are still being worked on, so we appreciate you explaining that. We did receive a few questions before the session started and have received a few live about testing. So I'd like to ask Ryan McKay to explain to us a little bit more about, I know the health department has a lot of plans. I work at the health department. I hear about it every day. We're expanding our testing. What about specific neighborhoods or folks who are at risk, like long-term care facilities and African Americans in the community?
Thank you, Kathryn. To start with, on the long-term care side, we have, working with VDH and the University of Virginia, have done what's called point prevalence surveys within long-term care facilities. And what that means is initially a certain percentage, 5 to 10%, that had tested positive within the facility, we would go in, work with our partners to test everyone, including staff. That way we would get a better snapshot of what COVID looks like within that facility, the number of people who have been tested positive. That helps the facility and the staff isolate individuals who are sick and then quarantine individuals who may have been exposed. That has been expanded a little bit. So in last week, actually, VDH decided that when one person within a facility tests positive, then that point prevalence survey can be conducted. With support from UVA and the National Guard, I think we've conducted a total of 3 point prevalence surveys so far in the health district, and we'll be conducting another one shortly. It's a tremendous asset to have, to be able to bring in partners to do that, particularly for a group that is the most vulnerable and at highest risk. As far as communities, African American communities, rural communities that don't have access, we'll be using our community site team to go out to those neighborhoods to conduct testing. Working with community leaders, we have already identified a list within Charlottesville and Albemarle that we want to identify and prioritize, and then we'll work with community leaders and partners in the localities to do the same.
Great, thanks. And we have a friend on here online, Jan, who asked, why is Virginia 48th in the country in testing for the virus?
Jan, thank you for your question. I think a lot of why we have struggled to increase our testing is related to capacity, whether that's having the right supplies, the test kits, the swabs used to collect the specimens from the individual, the testing capacity within Virginia, and certainly the protective equipment that individuals need, the N95 masks, the face shields, the gowns. All of these are things that states across the country have had to deal with, and we're no different. And for whatever reason, we've had a difficult time acquiring all the supplies that are needed. What we learned this week is that we're going to begin to see an influx of all of those supplies so that local health districts, private primary care providers, hospitals can conduct more widespread testing, identify those communities that need the testing most, and go out and collect the specimens so that we can determine what the true spread of COVID is.
Great, thank you. And another question that kind of plays off of testing is, will it be open to the general public when the health department has testing events? And how about folks who are asymptomatic, so people who are not experiencing any symptoms at the time?
So to access the testing, what we'll do is a registration process where individuals can contact us through our hotline, and a nurse will ask, or a screener will ask, a number of questions about why the individual wants to get tested. We're really looking for individuals who are symptomatic, who may have had close contact with someone who is confirmed positive with COVID-19. And then we will go through sort of a process of identifying all the information needed to submit into the system. Through that registration process, we will identify a time where that individual can come to a drive-through clinic, go through in about 5 to 10 minutes once they arrive to get the test done, and then we will submit the test for determining whether or not it's positive or negative. It's been about 1 to 2 days for those clinics to get the results back, and then we would communicate the results, positive or negative, back to the individual. If it's positive, we'll conduct the contact tracing and make sure that we're identifying all of those who may have been at risk. We'll provide guidance for isolation and quarantine, depending on the situation. And then over time, we will expand potentially to asymptomatic individuals, particularly those who had direct contact with someone with COVID. These would be individuals maybe with those comorbidities or those health conditions that put them at significant risk, or maybe really close contacts, people who work within the same close area, or maybe it's someone who lives with a partner or a family member that did test positive for COVID-19.
Great, thanks. And I'll ask you just one more testing question and then we'll move on to another topic here. But our friend Carmen asked, can we get testing through our primary care as part of a regular checkup?
Testing through primary care providers depends on the provider themselves. They may have the PPE to do it, the personal protective equipment, and they may have access to the test kits. If so, then it's going to be up to them whether or not they want to test. It's best for individuals to contact their primary care provider ahead of time to see if they have that capacity to do testing, and then if they will do the testing for individuals seeking testing.
Great, thank you. So now I'm going to switch over and ask a few questions about parks. So maybe Chief Baxter could chime in on this. We've had a few folks who submitted questions before today's session asking about parks opening back up, soccer leagues. Even someone said that they noticed their son's soccer league will start playing games again on June 13th. Do you think that's too early for kids to be playing soccer and or for parents to gather as spectators? And then the other questions with parks relate to how is the city going to clean parks when kids can start playing and when the stay-at-home order is lifted and they can be on playgrounds?
Let me unmute again. Two great questions that I don't have answers for today. And as I indicated earlier, those are the types of challenges that we're trying to address right now. There's in every department in the city, there's a version of those two questions. And I would say, though, to direct the questioner back to some of what the governor said today. We're in phase one, and the limitation is groups of no more than 10 people. So you're not going to have a soccer game, right? But when we get to phase two, which may be in 2 weeks, but it may be in a month, and it may be in 6 weeks. We just don't know. It's going to depend on all those metrics, all those data points, hospital capacity, PPE availability, percentage of positive tests, et cetera, to determine that. So it's too early to tell when specific dates are going to be tied to specific activities. So I'm sorry I can't answer it in a more detailed way than that.
That's fine. I know that was quite a loaded question, and I will say we had a few folks answer that, and I think it's important to note that people want this information, and please rest assured that the city and the county and the health department are working hard to put these plans back in place so we can let the community know about these details. So maybe moving over to Chief Eggleston, we did receive some questions about PPE. So first, can you remind us what PPE is, and what is the supply looking like for first responders in the area?
Certainly. Thank you, Kathryn. Well, PPE is probably becoming one of those terms that everybody knows about now, but we refer to it as personal protective equipment. And it's a necessary equipment that we provide our firefighters and first responders so that when they engage with a patient, that they're best protected so that we limit the spread. So initially, when we saw the first cases of COVID across the U.S., PPE became a shortage across the world, quite frankly. I think since then, we've seen production increase quite a bit, so we're starting to see the supply come in. However, maybe not to the level that we're comfortable with, so we're being very careful about the levels of PPE that we choose based on the call type. And this really extends out to the hospitals and the doctor's offices and the long-term care facilities too. We're trying to be very careful and intentional, but at the same time ensuring that we protect both the provider and the patient. So at this point, I think we're in good shape. However, we're always cautious as we move forward.
Great, thanks. And in terms of PPE, there was a fit testing event that happened this week. And so Ryan, could you tell us about that fit testing event, what that means, and what providers in the area should be wearing N95s, the mask that everybody hears about, especially as dentist offices start to reopen? What can people expect to see with those and the testing event?
So the fit testing is specific for the N95 masks that we keep hearing about. These are masks that are specifically fitted to individuals' faces so that it provides the best protection against droplets, the stuff from a human body that causes the virus. Fit testing is a process that people go through to determine whether or not the mask they have is appropriately fitting, and if it is, then they can continue to use it. If not, then they need to go through another test to make sure that they're fully protective when it comes to the coronavirus. As far as the event this week, so we've had a couple actually. It's going on right now. The National Guard has come in and done a couple of events where they're fit testing. First, it was long-term care and assisted living providers, nurses, physicians that may be working in their staff so that they are fully protected when they go and care for our loved ones who are in long-term care, skilled nursing, assisted living facilities. It's expanded this week to those primary care providers, some dentists, dental hygienists who are performing procedures that cause potentially aerosolization of droplets. So certainly if you think about any of the tests that we're doing in the throat, not necessarily for COVID, but anything that's going to generate a cough, anything where people may expel any sort of droplets. We're trying to give those individuals that kind of protection, and the fit testing is the best way to do that. Again, it's happening today, and we may see additional events in the near future.
Great, thank you. And along those terms, do you have any recommendations for what folks should be asking their doctors before they head back there? Should they ask for safety plans? Should they ask what PPE they should be wearing themselves? Or what should they know when they're heading back into their dentist appointment?
Yeah, thank you. People can call ahead. It's really important that they do so to find out what procedures they need to take when they come in. So I imagine primary care providers are asking individuals who come to the office to wear a face covering. Initially, a lot of primary care providers would have you come to the door and make a phone call before you go in. When you go in, if you didn't have a face mask, they would provide you with one, and you should be receiving one if you go in and don't have some sort of cloth covering. You can ask questions about safety, about the protections they're taking, sanitation, how often they're cleaning. And you want to make sure that when you go in, there's an understanding about what the expectation is. What should you do when you get there? What to expect of the nurses, of the staff, of the physician, how long the appointment's going to be, and what measures everyone can take to protect each other from spreading the disease.
Awesome, great information. And I see we have someone live who has raised their hand, Susan. So if you want to turn your microphone on and ask a question, please go ahead.
Hi, thanks for doing this. Much appreciated. I was wondering if you can tell me if there's any coordination that's being done between the local hospitals and long-term care facilities related to employees at the hospital who might have been furloughed to the long-term care facilities that are so in need of staff right now.
That's a really great question.
Thank
Of course. So unfortunately, in today's session, we don't have anybody from UVA or Sentara Martha Jefferson here. I'll see, Ryan, do you feel like you have any way to answer that right now?
It is a great question, Susan. Thank you for that. Unfortunately, I don't have any knowledge of staff from the hospitals who have started to work at long-term care facilities or subbing in. Maybe Chief Longo might have some insight into that.
Chief Longo, do you know anything on the hospital side, if you have any input?
I don't, beyond speculation. I think one thing to keep in mind, though, as both hospitals begin to expand elective surgeries, the clinics begin to open up and take on more patients, you may well see some previously furloughed employees come back into the hospital setting. Again, I have no reason to know that with any degree of certainty, but I think it's fair to speculate that in any organization, certainly that begins to expand again after a period where there's been a pause, it may likely result in an increased employee workload, and therefore the likelihood of some of those employees coming back to work. But that is a really great question, and certainly a very critical need to those assisted living facilities who might be depleted of resources.
And Ryan?
Yeah, to follow up on that, so part of the reason for bringing in the National Guard to do all the fit testing was to shore up staffing within long-term care and assisted living facilities. That first weekend they were here, I think they provided fit testing for all of the facilities in Charlottesville and Albemarle. And in recent days, they've done fit testing for facilities in Greene County and Louisa County, and we had previously done one in Fluvanna, and I think they're working on something for Nelson. So providing that staff with the appropriate protection has shored up the staffing shortages, I think, and gives them a better sense of being able to protect themselves as they go back into the facilities to work.
Wonderful, thank you. And we've received a few questions about face masks and cloth face coverings, and I would like to ask Chief Eggleston. So I know that first responders are wearing N95s and healthcare providers have certain types of PPE, but do you think that community members should be wearing cloth face coverings, and are they effective in preventing the spread of COVID-19?
Yes, as the governor has stated many times, they're encouraging folks to wear face coverings, and we're trying to be very careful to differentiate between masks that are worn by healthcare professionals and firefighters and first responders and face coverings, which are made often out of cloth or homemade. Those that we understand are really to protect others from any kind of droplets and so forth if someone were to sneeze or just even have a conversation. So we're encouraging everyone, including our own employees, who are required to come to the building to wear to wear face coverings, to really demonstrate best practices, but also protect others as well.
Good point. It is really important that people wear them. And as Ryan and I showed earlier, we're both wearing our face coverings anytime we're in public settings. And I will say the health department sent out letters a few weeks ago to all grocery stores in the area to highly encourage that all of their employees and patrons in the store wear face coverings as well, because we know it can help prevent the spread. And I see that we have a question from someone who is live. So Ellie is on. So if you unmute your microphone and ask us a question, please chime in.
Hi, can you hear me?
We can hear you.
Okay, great. I am a grandparent. My grandkids live over in Richmond with my daughter and son-in-law. And I'm concerned because they are not into wearing masks. And they still want to see us on Mother's Day. And I'm feeling kind of afraid about that. Can you give me some insights as to, I've asked them would they be willing to wear masks that day, and she doesn't want to scare the kids. They're 6, they're twins. Can I just get some insight from some of the experts?
Yeah, I think that's a really great question. I will say, is there any particular person from our panel who wants to answer that? And if not, I'll ask maybe Chief Baxter. I know you have children, and it'd be a great opportunity for you to answer.
Okay, I have children. I don't have grandchildren. Yeah, I mean, that's a great question, and it's a difficult situation. I think we've all faced versions of that in our own lives in some way, shape, or form. I'll share with everyone, my mom lives down the street from us. She's 85, and it's been difficult for her. She's a very social person, and we keep making the point that you need to stay home. So I think exploring other alternatives to being physically together would be the first thing I would suggest or recommend. Hopefully I'm assuming the 6-year-old twins are probably pretty well versed in digital tech in this day and age. So maybe that's a way to bridge that gulf of wanting to see grandparents, but also wanting to keep them safe. And there's no great answer. It's just kind of where we are. And maybe a visit, but they've got to keep that distance. That's maybe the only slightly less safe alternative that I can think of.
Absolutely. I'm sure there's a lot of grandparents who are missing their grandbabies and want to hug them right now. And so it is a difficult time. I think what Chief Baxter mentioned, though, about technology is really key, and that folks remember that you can FaceTime and video chat, and we didn't have these years ago. So take advantage of the technology we have. Along the terms of face coverings, we have received a few questions about the enforcement piece. So Chief Longo, can you talk to us? Is this something that we can put in law? Can we enforce people wearing face coverings, or what are your thoughts?
Sure. If you're familiar with the governor's executive order, particularly the Second Amended executive order that was most recently published, there are provisions of that executive order that prescribe criminal penalties. None of those provisions pertain to the wearing of protective masks. They all pertain to social gatherings, and several of them pertain to businesses and similar types of establishments. But none of the provisions that are subject to criminal penalties pertain to protective facial coverings. So it's not a criminal violation that is subject to enforcement. It is something that is recommended in a widespread way, not just through the governor's office, but certainly through our health department, through the CDC. Here at the university, my officers are required to wear protective face coverings when they're interacting with members of the public and they're on patrol outside of their patrol vehicle or outside of their office area. They're universal masking throughout our medical center, our medical campus. And frankly, this is a great opportunity for your previous caller to socialize, your grandchildren, to what the future will look like for them, at least a foreseeable future. And the wearing of protective face masks, I think, is going to be part of that. But no, it is not subject at present to any criminal penalties.
Great answer. And you're right, it does sound like wearing face coverings will be something that we see for the next few months. And thinking of that, we have a few questions that have come in about this phase 1 that the governor just discussed at 2 o'clock. So I know this is hot off the press. Our live chat started right after the press conference ended, but there are a few questions that I would like to ask. So one of these is asking about health departments and overseeing the opening of restaurants. Can you talk to us about that, Ryan?
It's a good question. Something that we've been talking about with our environmental health specialist internally. What is it going to look like? How are we going to go out and make sure that restaurants are ready to open? First of all, restaurants opening will be at half capacity is what I believe the governor said. And it's going to be limited to restaurants, breweries, wineries that already have a permit for outdoor seating. So that's the first step. In terms of enforcement, it's not quite clear yet how health department is going to enforce these regulations related to the easing of restrictions. But I think what we'll do is make a concerted effort to reach out to those that want to open to make sure that, one, it's still safe in terms of preparation of food, which is something we traditionally do, and then working with restaurants to make sure that they're adhering to the guidance that VDH and the governor put out, hopefully in the coming days, so that when May 15th rolls around, if we still enter phase 1, we're able to provide the best direction and the best guidance to restaurant owners and managers to make sure that their staff are safe and to make sure that people who are coming to enjoy a meal out for a change are also safe.
Thank you. And can you tell us, is the health department putting any plans together to support other businesses and giving them recommendations like hair salons or gyms or other places that might start opening up soon?
We are looking into the different guidelines that are out there, either through the CDC, through the Virginia Department of Health, and then maybe best practices from other health departments across the country so that we can provide the best guidance. I've had one Zoom meeting earlier this week with a community center that wants to reopen and what that looks like. I have another on-site meeting next week to review a plan for another store to open, meeting the governor's guidelines, of course. And I think that's important. We will provide what we can. We can certainly provide individualized guidance and answer any questions. That could be done by contacting our hotline. Certainly they can connect to any one of us, whether it's environmental health, myself, or anyone on the team who asks questions. This is a whole community effort, and it's appreciated that owners want to contact us just to review some basics to make sure that what they have is going to keep their staff safe and those patrons to their businesses safe as well.
Thank you. I have a few other questions about openings for you. So one of them is, when will it be safe for daycares to open again?
It's a good question. So right now I believe daycares can open for essential employees, hospital workers, healthcare professionals. The guidance is going to be coming from VDH in Richmond. It's also going to come from the governor. And I think a lot of the things that we're seeing in terms of trying to prevent the spread, social distancing within the facility to the extent possible, making sure staff have face coverings, cleaning is happening regularly. Those are all things that are going to be part of an ability for a daycare facility and frankly any sort of school to reopen. Are they meeting certain requirements? Are they able to safely keep children socially distanced to the extent possible? And are they able to maintain a clean environment to the extent possible so that children and staff can be safe within that facility?
Thank you. And another question that came in is actually probably best answered by Chief Eggleston. So someone has heard that Albemarle County has hired a new emergency manager. Can you tell us who this person is and what their role will be with helping Albemarle County reopen in the coming months?
Well, thank you, Kathryn. Yes, we started the process some time ago, actually well before COVID started. But about 2 weeks ago, Nicole Matthews started with Albemarle County as our new emergency manager. And Nicole comes to us experienced working with the U.S. Army, mainly in the Texas area over the last year. So she comes with a wide range of experience, both working with the military as well as the private and public sector. So Nicole has been actively involved in helping us to frame how would we go about recovering, how would we integrate those plans that we see from the governor's office, as well as doing it from a regional perspective. So we're really glad to have her here. And one thing that we just talked about today is, although we may be turning now towards a more of a recovery phase of this, our objectives in terms of public safety do not change. We're still concerned and focused on making sure that we do this with the public's safety in mind, so that we don't overstep the great work that we put into at this point, and make sure that we do this in a very intentional and lockstep manner.
That's great, thank you. Another question that came in from earlier today is asking for Chief Longo, is it okay for people to still be walking around GVA even with the stay-at-home order? Can we, as the weather is starting to get nicer, can people go take walks and jogs around campus, around grounds, excuse me? And what insight do you have on that?
Absolutely, and they do with a great frequency. I'm on grounds every day. I see joggers, I see walkers, I see moms and dads with their children. We are mindful about the gatherings, and frankly, we receive calls for service, particularly in the area of the lawn, the Mad Bowl, and some of our other fields that aren't closed as athletic fields, where from time to time there will be groups gathering that are in excess of the number that the governor's prescribed. We're giving warnings and helpful guidance to folks that we encounter like that. But notwithstanding that, we welcome persons to come onto our grounds and to enjoy the grounds of the university with their families, but to do it in a way that's safe and respectful of other people, and to not congregate in numbers that are prohibited by the governor's executive order, so that we can remain safe and so that this recovery process can continue and sustain itself.
That's good. Thank you very much. And I see that we have a little over 10 minutes left. So what I'd like to do is go around and have each of our panelists provide a few more minutes of feedback, any last notes they want everybody in the community to hear, and anything else that's really important for us to hear as we're about to reopen in phase 1 starting next Friday. So let's start first with Chief Baxter with Charlottesville Fire Department.
Yeah, this may sound odd coming, let's see here. Can you hear me okay?
We can.
Okay. This may sound odd coming up from a fire chief, but earlier on in this broadcast, somebody asked a question about Virginia and testing, and Brian answered that very well. But one of the things I really hope the community is beginning to understand as we move forward is the great need to invest in public health. We are relying on these professionals in this pandemic environment, and we are trying to do everything we can as public safety professionals and emergency managers and local government officials and at the university to support their efforts. But it's become crystal clear to many of us that their ability to help us navigate through these phases over a long period of time is going to be very resource dependent. So I don't have a specific ask of the community right now, but I hope people are beginning to think about that as we move forward through these phases, because they're going to need all of our support and all of our expertise and a significant investment of resources to help us get through these phases safely.
As someone who works in public health, I love hearing that. I greatly appreciate it. I know we've all been working around the clock lately on this pandemic, and so thank you for that and those kind words. So Chief Eggleston, we'll come to you next. Is there anything you want the community to hear, and what are the important messages you want us to know?
Sure. Well, first I'd like to echo Chief Baxter's comments. We do need to continue to invest in public health, and I'm not just saying that because I work alongside our local health officials here, but it's very meaningful in terms of how we go about providing services to our community. We can't do it alone, fire department, and we need to do it in lockstep with the Department of Health and all our community. I would say that if anything, we're asking for the public's patience as we make a turn. We see some hope and some glimmer here that perhaps we have plateaued and that we're leveling off. And we didn't get to this level by mistake. We got to this level through a lot of hard work and a lot of community support and cooperation. So if anything, I'm asking for your patience as we continue to focus on recovery and do it in a very smart and an intentional way. And so that we can come out of this a stronger organization, a stronger community in the long run, because as I said previously, we still have a focus of this public safety at hand, and we don't want to do anything that would put that at jeopardy. So if anything, I really appreciate the public's support. My colleagues I work with every day been fantastic. So let's stick together and let's make this something that we can all be extremely proud of on the backside. Thank you.
I like that. Thank you very much. And next we'll go to Chief Longo, and I will ask you, Chief Longo, on behalf of my husband and many other sports fans and some questions we've received, people want to know if we're going to have sports in the fall. What's the UVA future going to look like in the next 6 months in this fall? And I know you're working on those plans, but let us know what we should hear for this.
Yeah, so I support Drew's, I'm sure, excitement about UVA athletics and athletics across our community. I'm particularly excited for our football team. I'm quite biased in that regard, but for other programs as well across grounds. Really, all that's going to be dependent on the very same things we have to think about as an academic institution, because really we're preparing to bring people back en masse to a place that's very dense and will populate very quickly, where people will be very close to each other. And there's always a risk associated with that. And that risk in this case is to accelerate the transmission of a very serious and deadly virus. So we want to be mindful of that as much as we enjoy the outdoors and we enjoy sports. We enjoy what it's like to be a vibrant community. We want to be patient to Chief Eggleston and Chief Baxter's comments. We want to be patient with each other. We want to be patient with the process. The process is not an easy one. It's not one that we've come to very quickly. Certainly the governor and the others in his position of governance around this nation have struggled with the question of when. And the when will come, but it will come slowly and it will come deliberately, but it will come with a whole lot of thought and a whole lot of preparation, also a whole lot of patience. And so I want to be patient that we'll be back on the field and that we'll be back in the stands and in the classrooms. But that's going to take some patience, that's going to take some time, and that's going to take some real thoughtful and deliberate decision making. And so that's, I think, where we're headed. And I know that our community will be patient with us and work through this as we do everything else in this community with perseverance, tenacity.
Great, thank you. Patience is a feeling many of us have had to learn in the last few months as we've had to stay home and the world has just changed around us. On that term, I'd like to go over to Ryan. If you can give us an update on the health department, any last things you want the community to know as we enter in this next new phase by the governor?
Of course, Kathryn. I will start by thanking, on behalf of not just our health district staff, but public health employees all across the country for the statements from Chief Baxter, Chief Eggleston, and Chief Longo, who certainly know the value of public health and the work that we're doing collectively as a community through our strong partnerships that have been developed over a long period of time is really showing in the effort of the whole community, not just the four of us speaking here today, but organizations that maybe we hadn't partnered with yet. It's a true demonstration of what we can do together to be successful through this, right down to the individual who is staying at home with their children, the individual who is wearing face coverings when they go out. It's been what's led to the success of our ability to slow the spread of COVID. So a little bit about what we're doing in the health district. So we are preparing to reopen some of our clinics, and it's going to happen slowly over the course of the next month or two. Speaking with our nurse manager about our family planning and clinical services, it looks like we might be able to do that by the end of June. That also, of course, depends on how quickly we move from phase 1 to phase 2, making sure that we have added that staffing capacity to do the contact tracing and the testing. We have nurses on our team who are doing both. They're doing community testing, they're doing contact tracing on a daily basis. We've realigned our staff to meet those needs, and so part of reopening is going to be dependent on building that additional capacity to carry out those testing and contact tracing functions. A couple of things that have come up. So a number of questions have come in about antigen and antibody testing. So I don't have any guidance or information on that at this point, and I think VDH is still trying to work through that. I don't know that there's been anything produced that's completely reliable. What we're recommending is that if people have symptoms, to contact their primary care provider, to go to an urgent care center, to contact our hotline. We want people to go get tested and get that PCR test that is predominantly used to determine whether or not people are positive or negative. More information will come out about the antigen and antibody testing, and we'll be sure to provide better information as it is made available. A couple other things. So for businesses who want to reopen, for faith-based communities who want to provide services at half capacity, guidance is forthcoming. We will make that available on our website. VDH will make that available on their website. And again, we are happy to have communication with individuals about what their plans are to make sure that they're sound, that they're going to protect their staff, their faith-based communities, and the people who are going to those businesses. A couple things just to wrap up. A reminder, so we are beginning to open. This is sort of phase 1 in Forward Virginia of what could be a very long plan that's fully implemented into phase 3. The steps that we used to get here, all of the social distancing, the physical distancing, staying at home, got us to this point. And there are additional measures that we want to take to make sure that we can go from phase 1 to phase 2 as quickly as possible. It may not happen within the minimum 2 weeks that the governor has outlined. It may take up to 6 weeks. So adhering to the guidance that is provided from the governor, from the health district, from the Virginia Department of Health is really important for moving forward to getting to phase 2. And when and if we get to phase 2, it's the same thing. We want to make sure that we're adhering to the guidance so that we can move from phase 2 to phase 3 as quickly as possible. In the absence of a vaccine, any reliable, effective treatment on a consistent basis, this is what the normal is. It's a slow reopening to meet certain measures to make sure that when we reopen a little bit more in 2 to 6 weeks or maybe a little bit longer, we're able to do that as safely as possible. I want to thank everyone again for their vigilance, for their patience. This is an evolving situation still, and we are adapting on a daily basis to new guidance and new information as it's made available. And certainly want to continue the partnership that we've built with a number of organizations and working with individuals to make sure that we are happy, safe, and healthy moving forward.
Thank you all. I appreciate all of our panelists that have helped us answer great questions today, as well as everybody who has participated in these conversations over the past 2 months. Thank you again. We appreciate you guys being here. We appreciate those of you who are staying home, those who are wearing face coverings when they go into public settings. If you need resources during this difficult time, give us a call. On the bottom right corner of your screen, there should be a phone number for the hotline. And this hotline is available Monday through Friday from 8 a.m. to 4:30 p.m. And we're encouraging people to call us if they need any resources, links to services, testing questions, or just general questions about COVID-19. We're here to help you, and we want to answer your questions. And we appreciate everybody tuning in and hope that you take care, and we will be in touch soon. Thank you.